Hi guys! So it's been a few weeks since I've put on any videos, and I've been in school, and we got like this is our 7th week, I think. So we're just about halfway done with the semester, which is awesome. But I wanted to put a video up to kind of show you guys a little bit of some helpful little tips that I have found this semester. For clinical this year, we're doing things a little bit differently, which is awesome. But we are doing papers this year that we have to write APA papers for our clinical on the patients that we're with, and it works out really good. But I found after the first paper that I kept forgetting to get some information, and you had to write down, lab values and all your assessments and all that kind of stuff, and I didn't really have a guideline to go off of them. And we normally had like a organization thing for when we put down medications and stuff, and we didn't have that this year. So I actually typed up my own, and these are really good that you can just do on Microsoft Word yourself. And they're really good for clinical, for kind of like looking things up really quickly and having that for the next time around, because you can keep all of the drugs written down so that you had them for the next one. So I wanted to show you guys a couple of things that I made up. For my clinical, I have my clipboard. And I keep notes all over on my clipboard on the inside and outside, because it makes my life so much easier when I can just open it up and see it. But this is my little packet for clinical. And this first page is what the instructors always provide for us, and it's just a breakdown of the day basically. And then there's a worksheet that we have to do too, so I kept that on here. But otherwise, I made up this really generic assessment form. And I just used the word Microsoft Word, and I inserted a table, just 2 rows, and then I filled it in. And so I have on here, for the top I have vital signs, and I have all the vital signs. And then for skin, I have temperature, color, moisture, your skin trigger, neurostatus, head and neck for symmetry and lymph nodes, pain, nose, any drainage, sinuses, eyes for glasses, GI, and just went through everything that I need so that I make sure that when I do my assessment with the patient, I'm not forgetting something, because it's just easy when you're trying to go through and do it really quick to forget. So I made up a little checklist. The other thing is for the medications, because you always have to write down all your medications and tell your teacher what they are and the side effects and stuff. So I made up this one. The whole page is filled with it, but on the top it has the drug name, classification, how it works, side effects, reasons that they're taking it, and then the route and time. And so this whole paper is like that. So when I get to clinical, I can just write the drug name in there and the dose, the time that I'm going to give it, and then I pull out my drug book and I fill out the rest. So that is like really helpful for me. And then the other thing that I did too, because we have to write down our lab values, is I did a template for that. So you can see on here it has all of the labs and then the normal values. And then I actually insert this table right into my my paper that I have to do. But all I do is when I'm there, I can write in all the values, and like, they have different days that they get them. So I have a few different rows that I can put for different days. And then when I get home, I can just fill it in. And so it saves me a lot of time at home to do that. And then on the back, I left a spot for x-rays or EKGs as well. So just a little hint, if you get to clinical and you have stuff that you have to look up every day, just go on Microsoft Words and make up a table that works for you, because you can do whatever, however you want to. You can make a table that works. And I printed out a whole bunch of them, so I have a whole bunch in my clipboard here. Another thing is that you always take your books and everything to clinical, because you're going to look up, pathophysiology for this disease or that disease. And those med-surg books are ginormous. They're huge. Well, a girl in our clinical actually had this, and I went on Amazon and I got one, and I love it. And it's just the Med-Surg Nursing. It's the older version, it's not the newer version, but it's the clinical companion. And this has almost all the diseases. It doesn't have all of them, but it has almost all of the diseases in here in alphabetical order. And then it tells you like the key points to those diseases. And it's just awesome to kind of get a jump start on your papers, or if you walk in and your client has, you know, something that you never heard of before, you can take a peek quick and be like, oh, that's what it is. These are the risk factors. These are, you know, the teaching that I'm going to do, or these are the interventions I'm going to do. And it's all right here in this book. I love this book. It was the best $8 that I think I've ever spent, ever. And the last thing that I have to tell you, because I was so excited about this too, is I got this at Walmart this year. And I haven't seen them since because they were on school shopping time. But it's a 4x6 note card holder. It has a little snap on it. And then it's the little binder. So in the front here, I have my insulins because you give insulin to everybody. But then I have like questions that you're going to ask or look at. I have all of the normal ranges for all of the vital signs on there for adults. And then I also have like sympathetic versus parasympathetic reactions. But then on the bottom, I tabbed it out. See all these little tabs. And I tapped it out, and I put in here my drug cards that I had before. I wrote new ones up, and I put them all in here. So I have bronchodilators, you know, diuretics, antibiotics. I have, you know, all these little ACE inhibitors, all these little things tabbed out, and then I have the information written on there, classification, how they work, and all that stuff. So if it's a common one, like this is aspirin, which I'm going to use pretty much on almost all my patients, it seems like. But if it's a common one like this, then I know when I write up my drugs on that paper that I have, I can just either pull this out and write it from here, or I can just flip through it because I know it's in here. And when it's a common one I've seen so many times, and it saves looking it up in your drug book. But this works really, really good. The other thing that I did in here is I have advanced skills this year, so we're learning like IV starts, IV medications, taking blood, those kinds of things right now. And I have another little tab in the back, a little clear tab, and in the back I have our rubrics written down for our skills, so that way I have it with me and I have a real generalized idea. So for IV start, I have the step-by-step of the skill on what I'm going to do. For drawing blood sample, I have a step-by-step. For giving blood transfusions, I have step-by-step. And then that way, at the end of the year, we will have our final test out where you get 3 skills in a scenario that you have to do all 3 of them. And this way I actually look through them more often, and it's like, oh yeah, with that one I have to remember to do this or something, where I would normally forget because I did it in the beginning of the semester. I just kind of flip through them every week, and then that way the skills are staying refreshed in my mind. So this is really cool. You could use it for other things too. I got another one, and I did like my note cards for studying for mental health, and I just kind of like wrote up different note cards of the different like bipolars on one and schizophrenia, and then I have it in another thing so you can just flip through and study it. But I really like this because you can add to it, you can take away from it, but it keeps them all like in a small little thing that I can carry on clinical. So those are just a couple more hints and tips for you guys. If you have any videos that you'd like to see or any questions for me, let me know. If you like my video, hit like, and I'll see y'all next time.